Today's lecture is about substance use disorder. Substance use disorder is one of the most commonly tested topic in a licensing exam. So substance use disorder is a medical condition characterized by an uncontrolled use of substances despite harmful consequences. It involves a range of symptoms including tolerance, needing more of the substance to achieve the same effect, withdrawal symptoms when not using the substance, and significant life disruption due to substance use. Substance use disorder can involve various substances such as alcohol, prescription medications, and illicit drugs. Effective treatment typically includes a combination of behavior therapies, counseling, and sometimes medication. Early intervention and a comprehensive treatment plan can significantly improve outcomes for the individual with substance use disorder. So let's talk about substance use disorder diagnose. For the diagnose, we need to have the criteria. There is a mnemonic in the Toronto notes which goes as pick with MCAT. The first criteria is used despite the physical and psychological problems. Failure to fulfill external rules at home, at school, at work, craving, withdrawal, continued use despite interpersonal problems, tolerance, need more substance to get the same effect, use in a physical hazardous situation, more substance, use for a longer period than intended, unsuccessful attempt to cut down, activities given up due to substance use, and excessive time spent on using or finding substances. So if you have two or three of the above mentioned criteria, it means you have mild substance use disorder. But 4 to 5 is moderate and severe is 6 or more than 6. But if you have them within 12 months. All right, let's talk about substance types in terms of their effect. We divide it into three parts. So, what are the substances and where they have their effect? The first one depresses the CNS. What are the medication that uh, kind of stimulate the CNS? And substances that are hallucinogens. So the CNS depression or depressants are alcohol, opioids, barbiturate, and benzodiazepine, and also GHB. Stimulants are amphetamine, methylphenidate, MDMA, cocaine. Hallucinogens are LCD, mescaline, mm, psilocybin, PCP, ketamine, ibogaine, and salvia. Now, in the next slide, I'm going to talk about every single one of them and the symptoms that happens during intoxication and during their withdrawal. First, let's talk about the substances that causes CNS depression, or they are CNS depressants. For example, alcohol, opioids, barbiturates, benzodiazepine, and GHB, which stands for gamma hydroxybutyrate. So, what happens if somebody is taking too much of these CNS depressant? Intoxication happens. And what are the intoxication symptoms? Euphoria, slurred speech, disinhibition, confusion, poor coordination, coma, severe form causes coma. Now, what happens if they suddenly stop taking all these CNS depressant? They would experience certain symptoms like anxiety, anhedonia, tremors, seizure, insomnia, psychosis, delirium, and finally death. Let's move on to the second sections of the substances, which are the stimulants. We all know they start with amphetamine, methylphenidate, MDA, MDMA, cocaine. So, what happens if somebody is taking too much of these substances when the intoxication happens? So, we should be expecting symptoms like euphoria, mania, psychomotor agitation, confusion, anxiety, psychosis, especially paranoia, insomnia, cardiovascular complications like stroke, MI, arrhythmia, and seizure. Now let's talk about the withdrawal. If somebody suddenly stops these medication, what happens if they are not taking them? So we should be expecting some symptoms like crash, craving, also dysphoria, suicidality, which is the worst part of their withdrawal symptoms. That's why most of these people, when they go to the withdrawal, they kill themselves. Now let's talk about the last section of the substances, which is the hallucinogens. We all know about the list is LCD, mescaline, psilocybin, PCP, ketamine, ibogaine, and salvia. So what happens if somebody is taking too much of them? Intoxication happens. So what are we expecting in their intoxication? Distortion of sensory stimuli, enhancement of feelings, psychosis, visual hallucinations, delirium, poor coordination, anxiety, panic. And withdrawal, usually it's absent. Let's talk about substances. We covered almost everything. So let's talk about a few MCQ questions then. Yeah, let's do a few MCQ questions. We will talk about antidotes in the next video. So here we have a 38-year-old woman present to the clinic with her husband who report that she has been increasingly drowsy and confused over the past week. She has a history of chronic back pain and has been prescribed the diazepam for muscle spasm. On examination, she is lethargic with a slurred speech and unsteady gait. Her husband mentions that she has been taking more pills than prescribed. So it means the patient is taking too much of CNS depressant. So what's the most likely diagnosis? Is it acute alcohol intoxication? No. Benzodiazepine overdose? Yes. Opioid overdose? No. Serotonin syndrome? No. So what is the answer? The correct answer is option B, benzodiazepine overdose. Let's move on to multiple choice question number 2. A 25-year-old male is brought to the emergency department by friends after he collapsed at the party. What happens at the party? Too much drugs, right? They report to took multiple doses of Molly, which is also called MDMA, over several hours. On arrival, he is agitated, diaphoretic, and has a heart rate of 140. His blood pressure is high and temperature is high. What is the most appropriate next step in the management? Do we have to give him naloxone? That's for opioid. Initiate rapid cooling and sedation. That should be an option. Provide full of mazinil? No. Administer activated charcoal, but the cooling down would be a good option. The last scenario of this lecture. A 19-year-old college student is brought to the emergency department by campus security. He is disoriented, experiences visual hallucinations, and appears to be talking to imaginary people. Okay. His friends mentioned he took a tablet of LCD, which is hallucinogen, a few hours ago. On examination, his pupils are dilated and he's tachycardic. Which of the following is the most appropriate initial management for the hallucinogens? Administration of benzodiazepine. A should be the correct answer. Start antipsychotic medication, perform gastric lavage, administer flumazenil. The first one is the correct answer. Administer benzodiazepine. All right. Thank you very much for watching this video. This video is prepared and posted by me, Dr. Muhammad Nasib Jallah. The main purpose of uh, the main purpose of this informative and educational video is to keep Afghan female medical students, doctors, healthcare workers up to date with the latest medical knowledge and education, especially those who are deprived of their basic right to study and save lives. It also aims to raise health awareness for all Afghans in Afghanistan. This informative video may also help international medical graduate IMGs who are preparing for NACOSKI and even for MCQE1. Thank you very much. If you guys have social media, please like, follow, and subscribe our channel and share it if you like. And thank you very much. Uh, I have been using a lot of resources for all my educational and informative videos, but the most common resources that I usually use is Toronto and UWord USMLE. Toronto is a reliable source for Canada, and UWord USMLE